Welcome back, Toddler Tribe. We are here with an amazing guest. Dr. Elisa is going to share some really interesting things with us about selective mutism. And specifically, we're going to dive even deeper today into the idea that there are signs that your child has communication anxiety, and you want to be on the lookout for it because maybe they're just not ready to say it. Dr. Elisa, thank you so much for being here.
Thank you. Thank you. My full name is Elisa Shipon-Blum, but people call me Dr. E because they can't, pronounce Shipon-Blum. And so you're welcome to just call me Dr. E. Um, I am excited to talk with you today. This has been my mission in life to bring awareness to what selective mutism really is and how do we support parents? How do we recognize it in children? How do we educate teachers? Ultimately, how to give these kids their confidence,
Mm.
lower their anxiety so they can find their words.
Yes, find their words. I love that. So I came to this deep love of how words build brains and bodies and spirits through my work as a linguist and also by training as a teacher of the deaf and hard of hearing. And I had a lot of kids who were apraxic, aphraxic. They just had so many challenges in getting out words. What brought you to this mission where your soul just said, I need everybody to understand this?
Oh my gosh, thank you for asking that question because I am a board certified family physician by trade. So I came at it from a physician standpoint, but I have 4 children, and my second oldest, Sophie, was not speaking in preschool. She would not speak to her aunts and uncles. She was very shut down. She really was a different person at home than she was out of the house. And so you can imagine as a doctor how frustrating this was when I'm like, wait, what's going on with my super bright, chatty, overly verbal child at home, bossing around her, her siblings but yet out of the house, honestly, she was just a different child. And so it was really tough. And so from taking her from person to person, because everyone's like, oh, you need to take her to places and be evaluated. She was misdiagnosed. She was misdiagnosed with severe intellectual disability. Back then it was called mental retardation when
Ooh.
she was young. Yeah, that's what it was. Well, she's 31 now. So back then that's what they called it. Autistic, she'd most likely be institutionalized.
Ooh.
Others told me there was some abuse going on. Well, as in my gut of gut, I knew it was none of those things. And so it became my mission to try to figure this out. But I think the frustrating part for me was that as a physician, there was like nothing in my medical training other than a couple lines in my Nelson's pediatric textbook through med school that said children who are choosing and refusing to speak. And I knew that she wasn't choosing or refusing. She just really couldn't. So as a result of Sophie, I decided to start a nonprofit to try to figure this out, bring awareness. And, 30 some years later, here I am having dedicated my life to bringing awareness, but educating, doing research, having researchers study this, and developing an evidence-based treatment to help these kids. And honestly, my daughter now, because I know that's a question, like, what's she like? What's she doing? So I just want to
Yeah.
kind of, before we get into the meat and potatoes of what SM is and what it isn't, is she's a fully functioning woman. She went to med school. She's a doctor. She's a family physician. She's married, about to have a baby. So yes, I'm about to become a grandma for the first time. And yay. And she is just a fully functioning human. And I can't even imagine to have listened to anyone, others that have told me things that I knew weren't true and where she could have ended up. So thank God for my medical degree.
Mhm.
But this is what fueled my passion, was starting this organization. Back then it's the Selective Mutism Association, but I've since started the Selective Mutism Anxiety and Related Disorders Treatment Center, or the SMART Center, as well as the Selective Mutism Research Institute, because it really became a mission of love for me. Because as a parent, I can't even imagine what other parents are going through. They don't have the knowledge that I had. And so, or have now. And so that's such a big part of my mission, is to bring awareness to what this is and what it isn't. Because you know what? The term selective mutism is a horrendous term for what this really is.
Yes. You just brought me all the way back, Dr. E. I also have adult children. And my 22-year-old, as a teacher, I had a degree of awareness and education behind me of what felt developmentally appropriate and what didn't. And I'm not a physician by any means, but she just could not interact with the world well, consistently, appropriately. She signed out there, and I would interpret for her because she didn't want to talk to the other people. But this was 2 years old, 3 years old, 4 years old. And at 5, they diagnosed her with generalized anxiety disorder, which basically meant the world stressed her out. And so, gosh, if I had known back then, but I had my instincts, and so did you. You had your education, but you had your mama instinct in that.
Instincts.
Yeah.
I tell parents that if it doesn't feel right, it's not right. You are mama bear. You know what feels right and what doesn't feel right. And you're exactly right. And I think there's a lot of parents, unfortunately, that are walking around out there being told things about a lot of things that aren't necessarily true. Right. And you need to really dive deep when that happens, because that means it's just not right. You understand your child. And I think one of the things you brought up is a child that's disengaged. And that brings me to what SM really is. It's a social communication anxiety disorder. The term selective mutism focuses on what they're not doing. It focuses on a symptom. It doesn't focus on what's really going on with these kids and who they are. And so the problem with the term is it implies, what can we do to get them to talk? But what you're doing in that case is you're ignoring what may be causing them not to talk. You're reinforcing their lack of communication because you're trying to get them to do something they can't do at that time. And so it causes more anxiety, more avoidance, more frustration on the child's part, the parent's part, the teacher's part. And so that is my mission in life. I've dedicated my life to trying to figure this out. And when you see it from not a focus on talk and not talk, but a social communication anxiety, where the first step is engaging, and you're describing a child that we typically see. A young child who is not engaging. They're shadowing their parent. They're shadowing a sibling. They're shutting down when someone asks them a question and get that deer in the headlight look. They're hiding. They're looking uninterested. They have a flat affect a lot of times when questioned, but in the comfort of their home, they're totally different kids.
Oh, yes. She had her sister wrapped around her little sister, doing all the things that she wanted her to do. No problem here at home. So I have to ask you this question, because what happens when I see this with parents, especially now, and I would love if you could speak to kind of this post-COVID anxiety interaction space, because it's a mess.
Oh, yes.
But what I see is parents and other people kind of speaking to the child's identity. Oh, you're so shy. And when we do that, what additional damage are we doing?
Yeah, you're labeling them with that. They feel scared, they feel uncomfortable, but they're not scared, uncomfortable kids. It's how they feel. And so a big part of working with these children is helping them identify feelings and not labeling, I'm this, I'm that. It's how I feel. It's how I feel in this moment. But there's so many moments you don't feel like that. So to label you, I am just like you. I don't like labeling them. I like helping them understand themselves. So a big part of what we do is helping them acknowledge their feelings by using simple feelings charts, but also being able to kind of demystify this. What is this for them? And one of the things that I developed, because how I see this is, the name's horrible. It should be social communication anxiety disorder, plain and simple. There are factors into why a child isn't speaking and what may be maintaining it. And then in addition, there's stages of social communication that these kids are in. you were describing your child in basically a stage 0.
Mm.
They weren't engaging, they weren't interacting. Someone questions them, they almost seemingly either ignore or shut down. That's stage 0. You can give them all the money in the world, all the trips to Disney. It doesn't work to get them to talk because they're not there yet. And so there's different stages. There's the nonverbal stage. There's transitional stages with using intermediaries or shaping sounds into words. There's verbal, which starts out as 1 or 2 quiet words, fairly audible, to initiative, elaborative, and expressive. And so when we respect where they're at and we understand those factors, then all of a sudden it all starts to make sense to parents, because ultimately you, as a parent, are their everyday coach. I can tell you what I see and what I recommend and suggestions and strategies to do, but you're living it every day.
Yeah, and it sounds like what you're describing is a way of kind of redefining the arc of expectations for parents.
Yes.
And I
Yes.
love that you gave each one kind of its own benchmark, because our adult cognitive brains really do like ticking boxes. So if we see there's about 8 of them to get through, if we're only on the second or third, it's okay, because we'll keep going.
And it's not linear, which is interesting. Like you could have a non-engaging child not interacting. So you go to the store, your child's, I want this, I want that, let's do this. But then the minute somebody engages them and says, oh, can I help you? Is there anything you're looking for? Or you're so cute, what's your name? And the child just gets that deer in the headlight look. That's like, it doesn't mean they're going to be there forever. It just means that's how they are now. But there's things as parents that you can do to help them through those situations. Something as simple as being on the lookout. How many people can come up to us? What can they ask? But it's really redefining what this is and helping parents realize, meeting them where they're at is so important.
Yes. Oh, and I'm hearing you talk and thinking about the human factor, right? That when we are willing to talk to somebody, it means that we have a certain level, whether it's small, medium, or large, of trust that we can. And the fact that we're going to
100%.
feel respected when they respond to us. Now, it makes sense to me that strangers don't have those two things, and that maybe even certain family members have limited amounts of those resources from the child's perspective. How can families start to talk to their kids about that little extra risk taking, like when it's going to feel safe enough to try?
So it's interesting you brought this up, and I don't think I've gone through this angle very often, but you just brought something up that makes me realize something. When you're dealing with a waiter, a waitress, a store clerk, someone like that, you're not building a relationship. It's a very kind of mechanical thing. And so you see it different. It's more of a game to play in a restaurant, like the store game, or I'm sorry, the restaurant game, or the give my order game, or the restaurant game, whatever the game may be, the scavenger hunt in a store. And part of that game is a parent, let's say, starting it out by approaching a store clerk and playing the game. And the children will make that progress because of how the parent questions them in that scenario, how they prepare for it in a fun way, how they set up the visuals, whether it's a scavenger hunt or a give my order game. And then they ask a child, let's say, a question. Instead of answering for them or telling the child to answer, you bring them into the encounter by re-asking a question a certain way and preparing in a fun, upbeat manner for young children. Older children, it becomes goals they're working on. But with friends in school, with aunts, uncles, there's relationship. And in many ways, they are harder than the store clerks and restaurant people, because you're never going to build a relationship with them. And the waiter's a waiter, whether you go to Chick-fil-A or you go to the Cheesecake Factory, they start to label it as a waiter. And we do encourage the same restaurants over and over, like the same 3, repetitive. But with peers, with relatives, comfort and connection and bonding that way is the step. You don't do that with a waiter or waitress. You're playing the game or doing an activity that as a result of what you're doing, the child makes progress. So how we frame it is game playing, goal doing, and the parents being taught how to bring them in. But then with peers, it's building a connection, having a get together, which I do want to talk about COVID because this has so affected get togethers. But
Yeah.
having a get together in school, the small groups, the buddy process, how to work that. And that's how we build the comfort and the connection that is facilitated by the adult. So children don't come with a guidebook. It's the adults that have to facilitate.
Wow. Yeah, I love how you framed that as transactional versus relational.
Yeah,
That is a
I love this because I never really said it like that until you just asked me that question. But it is. It's very transactional versus relational.
yes. Ugh.
Podcast
Well,
in itself, by the way.
this happens a lot, by the way, Dr. E. We all get, it's just so fun when we play off each other and these big ideas start to emerge. And that is the whole point of having these conversations.
Absolutely. And you give me, like, from your background and your expertise and your experiences, you frame things in a way that the listeners may see it in a different way, in a good way. Like, you're adding so much more and gives, like you said, perspectives and other topics and deeper insights. It's wonderful to talk with guests.
Yes. So listen up, Toddler Tribe. If anything's pinging for you, you know you can go and like make it, rate the show and then leave the review. But instead of a review, make it, hey, do an episode about this, right? Tell us what you're looking for
I
and
love
we
that.
will bring it to you because that is our job. So let's go there. Let's talk about COVID because essentially, in a nutshell, what that did was pull the plug on typical daily human interaction that kids had. If so, from my world, this is how I see the COVID generation. Okay. Um, Kids who were born in 2020 or 2021 were born into it. And so they had what I call relational neglect or linguistic neglect because they didn't know what they weren't doing because it never existed for them. Whereas my kids that were already 1 or 2 or 3, when COVID hit, they were developing human relationships. They were in the middle of developmental up levels, and they were starting to redefine those personal connections when all of a sudden it was stripped away. So, whatever feels more aligned for you to talk about, I would love to know what you're seeing because I can tell you what we're seeing in the preschools and the kindergartens right now are kids who have such high levels of social anxiety that they can't separate from their parents, and the rest of the day is them trying to get their nervous system under control and very much struggling to.
Yeah, I mean, it's amazing to see the change as time went on. I mean, it's exactly what you said. So there was this period of time, whether they were young children in that midst of developing those language formative years that they need, 2 to 4, and then also the kids born into it. We saw a lot of kids coming to us where they didn't know how to interact with humans. So every time they saw an adult, they were terrified. They were very overly connected in a learned helplessness way to their parents. And so we'd see these kids, let's say a couple years ago, that were 1, 2 years old, and they came to us, let's say a year ago, and it was like they didn't know how to interact. So adult asked them a question, they shut down, and they couldn't interact with adults. It's almost, and you say to yourself, why? Well, every time they were near an adult, don't go near them, stay 6 feet. They also had masks, so they couldn't read faces. And so we saw the kids that were very, very afraid of adults. We saw the kids that didn't know how to interact with kids that had very limited interaction because we see a wide range. We saw some individuals where they were interacting with kids throughout. They weren't as bad. But the families that kept those kids home for 2, 3 years, so to speak, and in our population, because a lot of the parents are anxious about, like, a little more anxious, there's a lot of a genetic predisposition with the anxiety. Some of them were even more so avoidant of others and kept the masks on longer. And because our kids are more like anxious kids, they wouldn't let go of the mask. So it was hard getting the mask on, but then it was almost impossible to get the mask off. So we saw this happening. kids weren't comfortable with kids. They didn't know how to interact, and they also struggled with adults. So we were seeing that play dates went from, having them a couple times a week to nothing. And now parents who went through that time, obviously, they aren't having the play dates they used to have. So those opportunities away from the group, which is such a core component of building comfort and connection, away from the full class. Because I always say comfort, connection precedes communication. Progress rarely occurs in a group, except for, I say, CommuniCamp. That's our intensive group treatment and parent training program, because that's where it does happen in a group, because kids see other kids like them, that social identity piece, and parents feel connected and supported. So that's the only exception of progress occurring in a group. Most of the time, it's what can you do away from the group to build peer connection and comfort building, which will fuel confidence and communication, especially as adults facilitate strategies. But so they're not having the play dates the way they used to. So now we're relying a lot on school, and we're relying on small groups in school. And that's much more difficult than having play dates and get-togethers out of school. So parents of a lot of the kids are just not doing it. They're putting their kids in activities, but they're not doing those home play dates to the amount that we used to do. And so I'm seeing this. The biggest ages hit were the preschool, early elementary, and the middle schoolers.
Yes.
Those are the ones that we see the biggest, dent. The biggest, and then of course, the college kids starting missed out on a lot of adult growth. But because for the purpose of this podcast, yeah, it's been tough, and it's still lingering. It's not even like it's done. And then the reliance on technology, God help us.
I know. I am so glad you just tied this into the classroom experience. One of the things that I always say is, I had an amazing guest on in the fall. Her name's Lisa Dene, and she said everywhere in our life, every environment is a classroom, right? We learn everywhere. And so one of the things that I teach is that your child's childcare provider, your child's daycare teacher, your child's early childhood educator, those people that they spend between 25 and 35 hours with a week outside of the home, they're an extension of your family. Your kids see them as a surrogate parent. And so to own that and to build the relationship there. So how would you ask or encourage parents to, if they had to build one relationship, focus on it? One peer and one teacher, just really early days for these kids.
I would say that when parents are the beginnings of treatment with the typical young child that presents with a very strong social anxiety tendency, and remember, what I didn't touch on in this podcast are the other additional reasons why children develop SM, selective mutism, versus being just shy, because there's a lot of kids that aren't shy, and it's like, well, what's going on? So definitely would love to touch on that for your audience. But what I would say is the hallmark of building connection is 2 to 3 kids, not one, and I'll tell you why. By focusing on one, you're putting almost a little undue pressure on that other child. And we have to be careful, because we don't know how that other parent's going to be with that one child being that buddy. Because our kids in the beginning are very kind of we're buddying them up, but they can get a little dependent if that's their only buddy. So I say 2 to 3 to 3 to 5, depending on the child's age and comfort and where they're starting. And so the teachers will pair and group them with the same 2 to 3 kids, young children based on interest. So if there's another little boy, I had a little 5, 6-year-old loved chess. There happened to be another kid in his class that loved chess. I had another little girl that she just happened to absolutely love Paw Patrol. And so we found 2 or 3 kids that love Paw Patrol. And so we bonded over those common interests, because I often say it's the areas of interest that they're going to find their peeps. So if we can find areas of interest with some commonality, whether it's playing in the housekeeping area of the classroom, they have the little area, or it's doing puzzles and utilizing what we call big shot roles, helping your child build confidence. So if your child's good at puzzles or good at chess or good at riding the bikes out at recess, emphasize that, because those are the areas they're going to be the most confident in. And that's when they're going to be like a little bit of a leader. So, hey,
Mhm.
Becky, would you go help Samantha with that puzzle? You all of a sudden see that child, whether she's speaking or not, kind of engaging, especially as the teacher does it, confidence boosting. So it's finding peers of common interest, but also utilize confidence boosting activities.
This is fantastic. Thank you for making that intentional group. That's so important. And what about if parents are saying, okay, I am going to start some play dates again, regardless of my child's age. I feel like this is important. One of the things that I often notice is that parents choose adults that they want to hang out with.
Oh, yes.
And then like the kids are just kind of supposed to play. What are your number one guideline for facilitating a play date so that there's engagement?
So I love what you're saying. So you said the word facilitate. So I have to throw in, because I have lots of these terms. Don't wait, facilitate. Parents cannot wait. They need to facilitate strategies. So we like to make what we call theme play dates.
Mm.
The plain old come over and play is not enthralling to most children and even most parents. It's like, we don't need to do it. But if all of a sudden you're having a Halloween cookie making play date, or a holiday play date to make up like art projects and crafts, that's way more interesting. And so we want to theme it to make people wanting to come. So that's a
Yes,
little
please.
clue.
I'll
And
go.
you like it?
Yeah, I'll go.
You'll go. Exactly. I'll go too. We'll all go. And so we do this to kind of the interest, the excitement. But for our kids with SM, engaging with people, going to a store, having a list of ingredients to make a recipe, a visual recipe, let's say for the pre-readers or the just readers, so they know what they're doing. And they're going and the parents are saying, excuse me, miss, can you help us? Becky, are we looking for this or that? And bringing Becky in through the visuals and asking a choice, something so simple. And all of a sudden, Becky's excited now, right? She's getting her ingredients for the cookie making holiday, whatever cookies they're making. And it's motivating. It's a high interest. They're not interested in buying you shoelaces. They don't care about your hairbrushes. They want to be out and about with high interest activities. So that's a clue. And then parent facilitation. So if the kids come over and they can run around outside and you start playing I Spy something green or blue, to bring them in, that's fine. Or chalk time with letters on the driveway like at, bat, and sight reading and fun, goofy words. Again, you're facilitating social interaction and connection and communication, but also setting it up. So picture a mom or dad, a child, and another child with SM, in our case, a child that's a playdate child. Focus on the other child first. And what that does is that minimizes the expectation on your child with SM. Because the more you're focusing on her and telling her what she needs to do, she should do, she's not going to do it. And she's going to be avoidant and more anxious. So we want to make it fun, upbeat, high interest. Turn to the one child and go, do you want to add the flour or the sugar? Child might go, the sugar. You turn to your child with SM and do you want to add the salt or the water? No answer. Salt or water? Tell me. And you start facilitating questions in a way to help your child tell you at least, or to speak quietly. And it works so well because it's a high interest activity. It's something they do over and over. So the same 3 recipes, the same 3 kinds of cookies. So they know it, they own it, they're a big shot. They might help the other child. It's really cool how it works.
I love it. You are bringing me all the way back to when Claire was little. And she really did. Like, I had to homeschool her for
Oh, wow.
her
Okay.
second grade year, and just work on those social emotional and those communication skills that were coming from inside to get her confidence up. And one of the things we did is we picked a local family. We went to the food bank and we said, tell us a local family that needs Thanksgiving made for them because they can't afford it. And so we had, they signed off, obviously. It was on the up and up. And so we had pictures of this family, the mom, the dad, and the kids. And Claire had to do the grocery list, the grocery shop. We did the whole thing. We bought math into it. All the stuff. But then we made a almost like a script of options I made of things that she could decide which one or two she was going to say to them when we delivered it. Right? She didn't have to be the fear of what are they going to say to me and how I will respond could just disappear because I would do the majority of the talking, but she would get to say two things to them, and that would be her big win.
That worked for her, which is amazing, but many of my kids couldn't even do that. So, so the act of social engagement, of handing and taking, like handing the cookies to somebody, as you were saying, or something, or handing a piece of paper, that act of social engagement facilitates engagement, facilitates. So I call that handover takeover. Mm-hmm. And the act of a parent when they're walking around, having the child more in front of them that they're on the side. So it's called the front line. So we train parents to use these strategies because it welcomes you. If you're like, when you went to that house, if you did front line and handover takeover, that's like, let's say a game, that works. But if your child naturally hides behind you, it doesn't welcome that other person to question. The majority of people have appropriate social skills where they're not going to be like, hey, cat's got your tongue. They would see an uncomfortable child and say nothing. Yeah. Whereas as your child is on the front line, it does prompt them and to make a conversation, and we want that. But what we want it to be is that parents know how to help their child in that situation. So if someone says, Clara, how old are you? That open-ended, thought-provoking question. And you went, are you 5 or 6 with the right answer second? She hears the answer. That minimizes her need to think. And then all of a sudden it comes. Or 5 or 6, no answer. 5 or 6, tell me. And she feels safe to tell you. As you do that strategy over and over, the child gets louder, louder, and louder, and eventually speaks. However, I do have kids that could do interview games. Hi, do you like, or what is your favorite? And we call those interview games. But a lot of our kids, young kids especially, cannot do that when we meet them. They can't do it. And I think that's what makes the difference between shy and being like selectively mute. They can't speak. They can't do it until there's a comfort and a connection. But you as a parent facilitated, and you had so many natural instincts, because I could hear it, of what you did, which is great. But a lot of parents don't know what to do.
Yeah. And we walked into an energy of gratitude, right?
Yeah,
this family was predictably, thank you. This is so kind. This is so generous. And so, one of the things that was an option for her to say was, you're welcome. That's it.
The big 5 words: hi, bye, yes, no, thanks. Like you're welcome is one of the, the ones we add, like the big 6 or please. But I love it because that's like the waving game for some kids, the twister, the different types of waving games for engagement. But your child was able to verbalize stage 3. So you did like hi, bye, thanks, you're welcome, please. And that was a game or goal she did. And some of our kids will keep track of that. But yeah, she did it. And that was amazing. And you saw where she was at. You were able to assess that.
Yes.
I love that. And maybe she made the meal. So then it's like a big shot roll. Like she helped prepare it.
Oh, that's the turkey, the everything. Right? Yep. We brought the whole Thanksgiving dinner. Yeah, it was amazing. And the other thing I just want to kind of say as we come towards a wrap here is afterwards, being able to see where she was then. And this is still true to this day, by the way. My 23-year-old social battery drains very quickly. And so to be able to not ask anything more, not have any more expectations of her for a period of time after that battery has drained has been invaluable in her trusting me.
Oh my God.
To move forward.
I love this because what you're describing is something, well, first of all, a lot of children that I deal with selective mutism are highly sensitive children. So, HSPs, highly sensitive people. So they're highly sensitive to having sensory processing disorder. That's a large percentage of kids. much more than people realize. And that is also a factor into what maybe makes them stand out more with SM and shutting down versus a child that doesn't have as much of that. But then you talked about something called the 3 L's: look, listen, and learn. You looked at your child, you learned, you looked, you listened, and you learned. And you are respecting where she's at. And so you, instead of, come on, you need to, let's go, you got to, you should do this. That is what I call disrespects the child. You were saying, wait, her battery just drained. Like, you can't change that. You can only adapt to it and figure out ways to help her feel comfortable and minimize that. But like, you can come up with different strategies, like arrive early, don't rise to a whole big, loud, large, lots of people environment. But you were reading that, and I love it. The look, listen, and learn. I try to teach that to parents all the time, and they'll journal that for me. Their warm-up time in different settings, like, because they need to understand their child.
Mm-hmm.
So I love that you did that. Are you looking for a job?
I mean, this is just intuitively who I am.
It really
and I'm
is. I'm really impressed.
I'm really impressed. I'm always looking for opportunities to be able to kind of allow other people to understand they have this in them too, if they're just willing to stop the nonsense, right? To let all the crazy of the world go and like just be with their child for a little while. They will see it. They will feel it.
They are. Meet them where they're at.
Yeah.
That's one of my favorite sayings, is meeting them where they're at. Because a lot of parents have just, I'm sure you see this, like really high expectations, and they want them to do something or get somewhere. And sometimes our kids can't get there at the pace that the parents want them to, and that projects onto their child.
Yeah. Although that is 100% true. But what I also see on the other side of the same conversation is they're saying, I want my child to feel good. I want my child to feel whole. I want my child to feel successful. I want them to thrive without me. So I love this vision that parents have. And, as we wrap up here today, here's what I want you to hear, Toddler Tribe. Here's what I want you to get out of this. Your kids, regardless of how old they are right now, have been stuck in survival mode for a really, really, really long time. And when you are in fight, flight, freeze, or fawn as your reaction to everything over long periods of time, you get stuck there. And this is why it looks like all little people have high anxiety right now. There's hope. Dr. E is telling you how, she's telling you why, and I'm telling you that you can do this. Just if you need help, seek the help. And much like we say to people, get off the internet, stop listening to all the hacks and tricks and tips. Just whatever time you've been doing scrolling, start taking it with this intentional action and have a guide, have someone who's willing to take you through that journey.
And what's so beautiful is when they're so little, you're actually able to really change their brain. Like,
yes.
It's amazing. Yes. And they don't have the years of learned and conditioned behavior, because I see all ranges. And the younger, the quicker, and that's why early diagnosis. And let me say something. I'm not about a diagnosis. I don't care what it's called. You're not treating a diagnosis. You're treating a child. Mm-hmm. And I always say diagnosis is for two things: insurance reimbursement and school-based accommodations and interventions. But we're treating a child. So it's not about the name of any of this. Is if your child is dysfunctional, is not functioning socially, emotionally, maybe academically, even a toddler, like kind of reaching their milestones. They can at home, but they can't in the preschool class. And they're not communicating in a way to make their needs known, to connect with peers. You need some help, whether it's parent coaching and training, whether it's me, see what I mean? Like, it's not like the child, you're going to cure a child. You're going to train the parents. You're going to learn from the child and train the parents and train the teachers. Toddlers are I don't want to say, it's much easier when they're little. Mm-hmm. And it's amazing to see how how these kids blossom so quickly just by how you even just ask a question.
I agree. So, all right, here's the deal. You've got two jobs right now. One is to use the link in the show notes to go check out Dr. E's website. Everything has piqued your interest now. You're going to see exactly what you need to see and click on the right thing. I'm quite sure of it. And two, she has an incredible podcast called Unspoken Words. And if you want to keep learning and opening your brain to what this is all about, then I think your next best step is to go listen.
Thank you so much. Yeah, it's selectivemutismcenter.org is our website. We have lots of blogs, podcasts, articles, charts, whatever you could to learn about this. And we're also here to help and support families. But I'm excited to spread awareness, and hopefully some of your listeners gained a lot of really good tips today, because this has been amazing.
I agree. I agree. And, the timing of this release is really important too, because we are coming up on the holidays, people.
Yes.
So you are going to have a whole new bucket of social expectations and modifications and travel in front of so make sure whatever really resonated for you that you go check out more about it so that you feel more confident as you approach that season.
In their show notes, I think I'm going to send you a couple articles. One is called Tips and Strategies for Preparing for Halloween and the Holidays. And I think it could help a lot of your families.
Fantastic. Well, I know you have an incredibly tight schedule with everything that you do. So thank you so much for dedicating some time to our podcast today.
Oh, thank you for having me. I loved it. Thank you so much.
This was amazing. All right, Toddler Tribe, you know what to do. Until our next episode, stay mindful and proactive as we transform the toddler years.